This time, instead of looking at individual crown prep cases, we will look at several cases together. Also, we will view the original videos without cropping. Since it's the original, you can see the edges of the microscope lens. This is the original recording using an iPhone. Let's take a look. This is the process of prepping from the DB to the MB on tooth 46. The process of prepping from the DB to the MB on the buccal side. The sound isn't that important, so I'll lower it a bit. We prep from the DB to touch the 7 and then slightly retract and move over. However, the handpiece needs to be stable at this point. Place the mirror handle on the buccal side. Rest your right ring finger on the mirror handle for better stability and positioning. Then try to do the prep well. You need to prep following the cervical contour of the tooth to avoid undercuts. It sounds easy, but if the handpiece is not stable, the burr won't be stable either, making it difficult to create a clean finish line. So, resting on the mirror handle helps. From behind the patient at about the 10 o'clock position, we do the prep. Of course, you can do it from the front of the patient as well. As long as you can do it well, it doesn't matter whether you're in front or behind. Due to cervical abrasion, the finish line may not be smooth on the first try. Such abrasions can disrupt the prep. So, we try to avoid major undercuts. Now the buccal side is prepped. When looking at the lingual, you might think it needs to be tilted or adjusted a bit. Ideally, the evaluation of angles and undercuts should be done from a distance for accuracy. However, it is hard to see from a distance. So using a microscope helps. With the microscope, you can see that the lingual surface doesn't need much change. Just maintain the taper and clean the cervical area. Create the finish line following the cervical contour. Using the mirror to slightly retract the tongue with the left hand while prepping with the right hand. If the handpiece can be moved stably with one hand, it's fine. Otherwise, use a silk or Glickman clamp for retraction, freeing the left hand to stabilize the handpiece. This way, the handpiece and burr movement are much more stable. The idea is to ensure the burr is stable. Discussing posture and techniques for that. So, prep the lingual side like this, then the buccal side. Next, connect the proximal areas. For this, an air mirror M3 mirror is used, which prevents water droplets from obstructing the view. Maintaining a clear view is easier. So, when prepping while looking through the mirror, the dependence on the clinician's three-dimensional sense is greatly reduced, allowing for intuitive judgment of prep success. You can judge intuitively whether it's working or not. The combination of mirror work and the microscope is highly beneficial for clinicians. It covers almost everything, whether it's prep, endo, or surgery. For the mesial side, care must be taken due to cervical abrasion. Mesial prep is much more difficult than distal. A bit of instinctive cornering is required. If it doesn't work well, break it down into smaller steps, taking it step by step. Though it may be difficult at first, once you master the technique, it reduces the need for repeated prep and impressions. Crown prep accuracy is hard to verify for most clinicians. There aren't many ways to confirm whether it's done correctly or not, except by making a model from the impression. Real-time, chairside confirmation is difficult. Hence the use of a microscope to minimize errors. Now, let's look at tooth 45. Premolars are very small, requiring close cornering to adjacent teeth. The previously used 6878K016 is a bit large. So for premolars, sometimes the 878K014 is more suitable. Here, the movement of the burr tip is not that stable. Because the left hand is used for retraction, making it unstable to hold the handpiece with only the right hand. So, using a Silker-Glickman clamp for retraction, freeing the left hand to slightly hold the handpiece head, allows for much more stable movement of the handpiece and burr. For the buccal side, tilting a bit more might eliminate undercuts. Tilting a bit more might eliminate undercuts. Strategizing your approach is beneficial. I organize these materials because I'm also not sure Since I'm not sure, organizing these materials helps. Preparing your own presentation materials. Even if there are shortcomings and errors, your skills improve when you present in front of others. Not only do your skills improve, but your productivity increases as well. Productivity is also important for clinicians. There are no dental clinic owners who don't put in effort. Everyone puts in effort, but the direction is the issue. Even if it's a bit embarrassing, it's better to show it to others. Once the buccal and lingual prep is done with the right taper and without undercuts, just connect the proximal areas. Though sharing these materials might feel embarrassing initially, it can become a useful routine. Smoothly connecting the buccal and lingual prep areas from the distal side. If both sides are prepped correctly, connecting them smoothly and naturally isn't too difficult. So, this is how you connect them. Making a circle in one go is tough. But creating and connecting two semicircles is easier. Ensuring both sides are prepped correctly makes the connection a simple task. Once that's done, connecting both sides is a simple task. Mesial connection is definitely challenging. Connecting the mesial side cleanly is difficult to do in 1 or 2 attempts. I need several attempts. If the prep doesn't go well, use a new burr. Using a dull burr makes prep significantly harder. Switching to a new burr when necessary is recommended. Though direct view is an option. But in practice, mirror view, despite seeming cumbersome, results in fewer errors. Slightly adjusting from the occlusal view helps in real-time evaluation and judgment. Slight rounding of the line angle between the occlusal and axial surfaces. I don't know how much difference it makes in the lab results, but I just smooth out the slightly rough parts at this level. This level of prep is almost complete to my satisfaction. Now let's move on to tooth 36. Start by placing the burr on tooth 37, slightly lifting it, then moving from the DL to the mesial side. Similarly, place the burr on tooth 35, slightly lift it, then move from the ML to the distal side. This two-directional prep process can be done smoothly. For stability, rest the left hand slightly on the handpiece head. As long as the handpiece and burr movements are stable, the method doesn't matter. Whether the burr moves clockwise or counterclockwise, what matters is its stability. If the burr moves stably, achieving the desired prep is not too difficult. If the burr moves stably, achieving the desired prep is not too difficult. This level of lingual prep is sufficient. Now we can move on to the buccal prep. To prevent obstruction of view, rest the left hand slightly on the middle of the handpiece, not the end. As you practice, you will improve in how to stabilize the handpiece and guide it along the intended path. If you can do that, the method doesn't matter. This level of prep is clinically sufficient. Of course, looking at it under an electron microscope, there would be many flaws. But we live in an imperfect real world. So it's not good to be too harsh on yourself for not being perfect. Focus on completing your clinical work adequately. Then spend happy times with family and friends. I think these things are important. Being overly critical of yourself for not being perfect is not beneficial. Placing the finish line correctly on the distal side. Notice that tooth 7 looks a bit strange. So let's refine it a bit. To prevent food from getting stuck. There seems to be a crack on the mesial of tooth 7. And some severe wear between the teeth. Adjusting it to a more normal shape, making slight corrections like this. It took about 20 minutes today. Even dental students know how to prep a missile side. Everyone knows where the goal is. Like reaching the peak of a mountain. But there are various paths to get there. For example, the first trail, the second trail, or rock climbing. Everyone knows the final goal. But sometimes things don't go well regardless of the path. So, I'm just finding my own way. So, I've roughly done the buccal and lingual sides. Now, I just need to connect the proximal areas. The tooth material doesn't seem healthy. So I'll lower the finish line a bit. Securing sound tooth structure and smoothly connecting the buccal and lingual sides. Using the Silker Glickman clamp for retraction here as well. If not available, you could use a disposable bite tray. This concludes the rough prep. Today, I wanted to talk about stabilizing the handpiece head. With direct or indirect rests. So I showed you the original unedited video. If possible, I will try to add a cropped version at the end. So you can compare them. That's all for today. Thank you for your hard work.